mission at One Community Health is to advance health and social justice for all in our community. So when we talk about things like health equity, we are really trying to advance and create access to the highest quality care for everyone.
That was our original vision, was to serve the families of migrant and seasonal farm workers, but secondarily, anybody who might have problems with access to health care.
We started to grow a lot. We started to see more patients, we needed more providers, more dentists, but we didn't have the money or the funds to expand our facility. So we had to make use, we had to be very creative, and we used every corner of our building and made the absolute most of it.
One of the things I found really exciting at the beginning of the project was really the discussion around the vision for the facility. There was just a lot of really excited energy around trying to make this facility one that really welcomes everyone.
SEA and One Community Health came together back in 2010. And we started with assisting One Community Health in the development of their facility in the Dalles. It was discussed that at a certain point, Scott Edwards would be helping One Community Health to develop their facility in Hood River. So we did a series of studies, and it was determined that the facility in the Hood River, it needed to be demolished, and that we were going to develop a newer facility that would bring them a whole lot more opportunities for much more robust services.
When I was first introduced to One Community Health, it was clear they had a challenging project on their hands. I can recall multiple months with Haley and her team of bouncing design element ideas off of us and then being able to validate that we would be able to accommodate that in the budget.
At One Community Health's new facility, there were a few goals that we were trying to bring into the project. One was to bring a lot more program into the space that they hadn't previously had. We were having administrative spaces in there. We had a lot of dental operatories. We were also expanding their exam room spaces.
It's hard to do this financially, but through the assistance of mostly public and some private partnerships, to be able to offer care and outreach from such beautiful facilities really shows the dignity with which we regard our patients and our staff. It's such a pleasure to me as a patient of One Community Health to get to come into this building and to see it and again feel how it reflects the ethos of care that is provided here.
One Community Health came to us with this interesting challenge, which was how do we create waiting areas that don't feel like waiting areas? And so we use really bright, fresh materials. We also brought in biophilic artwork. We used this really cool dehydrated moss that brings not only color, but the feeling of nature inside. We incorporated a nice, rich brick. We also wrapped in these warm exteriors with cedar. One of the other nice design elements was the landscaping. We got the opportunity to work with Shapiro Didway, who was really attuned to Hood River and the landscaping there. And so as a result, we worked with them and One Community Health to really find a way to make the building feel set in its environment. And I think the landscaping does a really nice job to accommodate that.
I feel like this type of facility attracts dreamers, and we always dreamed big. We dreamed a lot. It was just really hard to make those dreams into reality without the right infrastructure in place. But now it seems like we have the resources to sustain programs. We have the infrastructure in place to bring new ideas and see them come into reality.
It's amazing. I feel like finally the outside represents the inside. You know, our providers are amazing, and now they're able to work in a space where they can provide the care and not need to reschedule somebody because they need to be seen later because a room's not available. We have the space, and I feel like our patients feel that too.
Our multi-purpose room has really truly been multi-purpose. We've used it for vaccines, for COVID testing, for exercise classes that we do both in person and then also digitally. For us, strategically, we want to not just be the place you come when you're sick, but also to be the place that keeps you healthy and that you trust in that process. So we plan to offer online and in-person cooking classes, Zumba, strength training, and other fitness classes that are accessible to our patients who might not be able to afford a Peloton or a gym membership, and really making those services accessible to everyone.
It's beautiful. I mean, the lobby is gorgeous. It's a beautiful place to sit and wait for your doctor to come and get you.
I just feel like there's a lot more space for our patients to spread out and be able to be cared for.
The clinic is, in my view, one of the most amazing representations of what community health care should look like. It is something that in some ways exceeds what someone would get with a private practice.
One Community Health is a wonderful success, and it has a lot to do with the team that made it happen.
It was clear from the beginning that we had the right team together. The One Community Health representation, from your owner's rep to facilities to real estate management, were fantastic team partners.
I would say this team that built this project was one of the best I've ever worked with. And instead of pointing fingers about who created the problem or who was going to fix the problem, we approached it like, okay, what's the solution? How can we get there?
I hope that everyone who comes here really realizes how top-notch all the healthcare and community health work that's provided here is.